Hello there. In this presentation, I'll be describing the causes, symptoms, and treatments of the disease endometriosis. Endometriosis is a chronic disease which affects the uterus. Normally, a layer of tissue called the endometrium lines the inside of the uterus and sheds once every menstrual cycle. However, in endometriosis, this lining grows outside the uterus and often on other organs in the abdomen. The main symptoms of this illness are very unpleasant and difficult to endure on a daily or monthly basis. The symptoms can vary widely from case to case, but most are the same. Women with endometriosis experience severe menstrual cramps and bleeding, pain in the abdomen, lower back, or pelvis, unusual fatigue, and painful urination or bowel movements. This condition can also make intercourse very painful or nearly impossible. Some symptoms of endometriosis are not visible, yet still affect the sufferer's body in negative ways. The endometrium tissue that grows outside the uterus also sheds during menstruation, but has no place to exit the body, so the abdomen swells. The tissue that remains forms scar tissue around other organs, causing blockages called adhesions. Kidney problems are also common for sufferers of this illness, as well as infertility, although the exact link between endometriosis and infertility are unknown. The exact causes of this disease are also unknown because each case is so unique. However, there are several theories. Retrograde menstruation may be responsible for this illness. In this case, the endometrium tissue inside the uterus flows backwards and exits the fallopian tubes, then implants itself onto nearby organs or the ovaries, causing adhesions. For some women, the disease may be in their genetics, passed on by one of their parents. Another theory is lymphatic or circulatory spread, in which endometrium tissue cells are transported through the bloodstream to other parts of the body. Some cases are caused by environmental toxins which affect the hormone balance. One of the known toxins is dioxin, an organic pollutant. The final theory, metaplasia, is the most likely explanation. In metaplasia, tissue cells retain their ability to change their function or specialize. In the case of endometriosis, cells surrounding the uterus respond to inflammation by changing into endometrium tissue and implant themselves onto nearby organs. There are several ways a doctor can diagnose endometriosis, some more effective than others. Women can receive a pelvic or rectal exam from a gynecologist, or an ultrasound, MRI, colonoscopy, or cystoscopy, a scan of the bladder, to scan for growths in the abdomen. The most effective method of diagnosis is a laparoscopy, which is a minimally invasive surgery in which a small incision is made in the abdomen and a camera is inserted to search for abnormalities. Once the endometriosis is diagnosed and located, one of several treatment options are suggested. Because the cause of this disease is largely unknown, there is no definite cure. However, there are various treatments to mitigate its effects. Hormone therapy is a popular option. Women can take contraceptives on a specialized schedule in order to stop menstruation completely, which helps to avoid swelling and excessive menstrual bleeding. They could also take a progestin pill or injection, a hormone that helps control the other hormones in the body. Or they can take a gonadotropin pill, which induces effects similar to menopause, essentially stopping the menstrual cycle and deactivating the reproductive system. If the patient does not want to take more extreme measures like stopping the reproductive cycle altogether, there are several over-the-counter pain or anti-inflammatory medications they can take to help control their symptoms. The final, more drastic option is surgery, such as a laparoscopy to remove small growths, or even a hysterectomy or an oophorectomy to remove the entire uterus or one or both ovaries. Though these options might eliminate symptoms temporarily, the symptoms can return even with the uterus gone. Surgery, like other treatment options, is unfortunately not a permanent cure for endometriosis. Thank you for watching! Now here are some questions to consider.